Shall we start, Jamal? Are you expecting your colleagues to come ولا نبدأ؟ Okay. طيب. Is this your last one? It's an easy one. Alhamdulillah. اللي فوق ما يشتغل؟ sorry, you want me to use the صح. طيب. بسم الله الرحمن الرحيم. يعطيكم العافية. I guess today is your, inshallah, last pharmacology lecture, and it's going to be an easy one, inshallah. And it is about the drugs acting on autacoids. If you are familiar with the words autacoids, then you know that they are actually locally produced modulating factors, or the old classification for them as local hormones produced at a certain site of injury, and they will modulate the function of the tissue itself and the component in that tissue. Okay, so these are local hormones, and these local hormones are supposed to be doing a certain function at the level of the tissue that they are produced in. And when we say local, then we mean actually that they are local. When we say local, that means it is actually, I think the battery maybe is flashing. Is that okay? Okay, when we say, switch off. When we say local hormones, then they are actually produced locally to produce a local effect. Okay, so it's very unlikely that you will see the autacoids that we'll be talking about today released with high concentration to the systemic circulation. Okay, their effect is primarily, as I told you, local, and although that you might see a large amounts be released into the circulation in some circumstances, like for example, if somebody has got an anaphylactic reaction, then the response itself is beyond actually the local tissue itself, right? Because there are too many mediators of inflammation are released to the circulation, and part of them is the autacoids. So that does not happen in every allergic or in every inflammatory response. That happens in special circumstances where they are released into the circulation. What do? They modulate the activity of the smooth muscles. Okay, so you expect smooth muscles in gastrointestinal tract to be sort of target for them. You expect the smooth muscles in the blood vessels, very important target for them. They again modulate the activity of the gland. So you expect some hypersecretion that might be happening with response. Nerves or nerve endings, and I'll explain to you what happens. Again, platelets are part of the cells involved in any allergic or inflammatory response, and other tissues as well. And the most important outcome from those autacoids that you will see hyperemia, which is the redness in the site of the injury, pain and itching, and if the response is quite extensive, you might actually find even bronchospasm to be an element to that response. Okay. Which autacoids that we are supposed to be knowing? We have histamine. This is the one that we'll be talking about today, inshallah. Okay, histamine is very important. Serotonin is another autacoids. Prostaglandins, okay, and leukotrienes. Prostaglandins, leukotrienes, and thromboxanes, they are subfamily called eicosanoids. That's another lecture by then probably you'll take, inshallah. And there are many others, autacoids. I think does your colleague hear me يعني عشان without the mic؟ طيب أنتوا سامعين. Okay, good. So the most important reaction or the response that you will see autacoids involved in, from what I have said, is what? Allergic as well as inflammatory response. So you must know that you always link histamine with allergic response. So what is histamine now? Histamine is one of the most important autacoids that is synthesized as a medicine first in 1907. And a long time ago, they were able to produce this substance of histamine And they were scientists, they were experimenting, trying to give it to somebody and see the response before they came to know that histamine is an endogenous substance that we have in our body and we release it in allergic response. So it was isolated, before it was isolated from the mammalian tissue. And it was noticed that if you give histamine intravenously, what will happen? It's the same signs and symptoms of anaphylactic reaction, okay? If you give it intravenously. Why? Because I told you, in allergic response, the effect of histamine is local to the tissue which has been undergone the allergy or undergone the trauma, صح? Okay, that's actually the local effect, the classic picture that we see. But if you are actually giving intravenously histamine, then you are actually causing a systemic reaction, which is anaphylaxis. So that's why they were able to see something similar to anaphylactic reaction that we see in hypersensitive individual being exposed to their sensitized antigen. Okay, so it's an important mediator of the immediate allergic and inflammatory reaction. What do we call the immediate allergic reaction? This is the type 1 hypersensitivity reaction, in which immunoglobulin is involved in it? IgE, exactly. Okay, so it's very important mediator of that response. Again, histamine is important for gastric acid secretion, right? And it's also classified as a neurotransmitter or neuromodulator, and interacts with too many neurotransmitters in the brain, and playing a role in immune function and chemotaxis. And the last one is something that has been found lately, okay? That even it attracts other white blood cell and attract them to the site of injury. Where do we get histamine from? It is synthesized in mast cells and basophils, and we synthesize it from an amino acid called L-histidine by decarboxylation reaction. And we have an enzyme called histidine decarboxylase that causes this decarboxylation reaction from the L-histidine. Once we synthesize histamine, it's not supposed to be, as I told you, it's not supposed to be circulating, okay? So either we synthesize it and keep it and store it in vesicles, or we're going to inactivate the histamine. So there is actually metabolic metabolites like N-methyl histamine. We have imidazole acetic acid, methyl imidazole acetic acid. There are some metabolites that we're not supposed to be seeing very dominantly in the circulation unless we are having histamine released into the circulation, and that happens in certain tumors. Okay, so once it's formed, either stored or rapidly inactivated, and most of the tissues, it will be stored vesicles waiting for a reaction or a trigger to be to stimulate its release. So if we do not have the stimulus, it's not going to be released. What are the tumors that will secrete histamine? Have you heard of any tumors, neuroendocrine tumors, something? Carcinoid tumor, carcinoid. There are some, they are rare tumors, they're not very common. So like carcinoid tumors, mastocytosis, there's urticaria pigmentosa, rare tumors, some type of leukemia, they might actually produce histamine. And in that case, you will see histamine as well as its metabolites accumulating in the bloodstream, okay? So this is actually the picture that shows you that this is a mast cell. It has got the vesicles, histamine is inside, packed, and these are the IgE antibody attached to the surface because they have been synthesized because of prior exposure to a certain antigen. Once the antigen happens again, it's going to bind with these immunoglobulin E and trigger the release of histamine from the mast cells and basophils. So, so we did mention that mast cells and basophils are one of the important sources to release histamine. Okay, we agree on this. Where else? We do have what is called or described as non-mast cell histamine, other than the allergic response that we know very well, which is in the interchromaffin-like cells in the gastrointestinal tract. Okay, in the stomach fundus itself, because I told you, it is very important regulator for gastric acid secretion. So it must be present in the parietal cells in the fundus of the stomach. So it is there in the interchromaffin-like cells in the stomach, and gastrin is the stimulus that makes histamine release. Histamine release is going to cause gastric acid secretion and acidity in the stomach. Somatostatin is doing the opposite, it's inhibitory. So it does inhibit histamine release, and accordingly, gastric acid secretion is going to be reduced. So that's an important, other than the allergic response, gastric acid secretion is an important target. Histamine, again, is classified, as I told you, as a neurotransmitter. So it must be present centrally. And what I would like to explain is that all of you, you know that histamine is important for cognition, I think. يعني I'm pretty sure that you know this. And for regulation of sleep awakening cycle. يعني what actually makes you now awake, okay, is some neurotransmitters like acetylcholine, you know that, and glutamate. There are certain neuroexcitatory neurotransmitters, and again, histamine is one of them, and might even interact with them, okay? Why we have, because we do have histamine one receptors in the hypothalamus, and they are in high concentration in the hypothalamus, so it is present centrally, and it's going to cause the cognition and alertness, okay? So it is a neurotransmitter as well, don't forget, and in the peripheral nerves, you can see in the sensory and nerve endings, once they are stimulated by histamine, it's going to release some peptides that are cause the pain and itchiness. طبعا all of us, you know that in any allergic response, do you know the triple response في الالرجي? If somebody is exposed to, what will happen if you get sort of a mosquito bite, for example? What will happen to you? What do you notice once you have an insect bite? Huh? Redness, yes. Actually, this is the first one of the triple. They say triple response. The first thing that you will see is the redness, and then edema. Okay, it becomes actually swollen, صح? And then it will start to be painful and itchy. Okay, so this is basically what it does, and I'll explain to you by the receptors of histamine how this response is going to happen. So this is part of the peripheral nervous, I would say the effect on the peripheral neurons, other than the central effect of histamine as a neurotransmitter. Okay, how histamine is being released? We did explain this antigen, immunoglobulin E, that's already there. The complex between the antigen and immunoglobulin, it will fix itself on the mast cell and cause release of histamine from the vesicles that are storing histamine inside the mast cells and basophils. So this is actually part of the type 1 allergic reactions that happens. And this is what we see in hay fever or in urticaria. This is actually a typical example, allergic rhinitis. Whenever they get up or they exposed to pollen, they will start sneezing, they will have rhinorrhea, symptoms like common cold, okay? And so this is part of the immunologic release of histamine. Again, histamine via H2 receptors, it can regulate its own release. You remember when we took the autonomic nervous system, we said that you have certain receptors that belong to the autonomic nervous system that are present on the neurons or the cells that are actually secreting them, okay? And the responsibility of these receptors is to have some auto-regulation. So you want more of acetylcholine, or you want less, or you want more of epinephrine and less, okay? The same thing happens here even with histamine, subhanAllah. So there is some negative feedback control mechanism because we need to end this reaction. It's not going to continue for forever. So you need actually, this is part of the control mechanism for its release. So accordingly, the histamine that has been released is going to cause vasodilatation, as we told, leakage of the plasma containing mediators of acute inflammation. And not even now mast cell and basophils, now even eosinophils, neutrophils, monocytes are all actually leaving the blood through the endothelium and becoming actually collected in the site of inflammation or the allergic response that is happening. Again, we said that has a chemotaxis effect and release of peptides from the nerve endings that are causing the pain and itchiness. It's not only IgE mediated pathway على فكرة, okay, because we have seen in the previous slide, we did mention that there are some other immunoglobulins involved. So there are some pathways that are involving IgG and IgM, and that involve complement fixation pathway. But ultimately, again, it will come from the mast cell, histamine will be released. Do we have other than the immunological release as a stimulus for histamine release? Chemicals, some drugs that we give to patients, they are going to displace histamine from the synaptic or مش synaptic طبعا احنا مش neurons نتكلم from the storage vesicles that it has in the mast cell. يعني it will be stored in state of histamine, so it will cause histamine release via pathway not dependent on IgE. So it's not immunological classically, so it's not involving immunoglobulin, but it's a displacement. And again, don't forget that any trauma will break up the mast cells with their vesicles and they will release histamine. So any mechanical as well as chemical injury will cause histamine release. Now we want to know about receptors. Do you know how many receptors we have for histamine? عشان في السلايد 4. Okay, yes. احنا there are currently 4 receptors. Histamine 1 and 2 are well studied. 3 and 4 still. Actually, more and more research is to establish what is their physiological function, and accordingly whether they can be has got some therapeutic targets or new drugs that can work on them if you understand what they are doing. So we have histamine 1 until 4, and all of them, they belong to G protein coupled receptor. That means we will have secondary messenger. Cyclic AMB, كل الكلام هذا, so it's involved in their mechanism. We need to know H1 and H2 very well. All right, H1 هو اللي حنتكلم عنه this lecture. H2 حتاخذوه في GI block إن شاء الله later. تمام. H1 is look at the distribution and the effect accordingly. It is distributed, you can see it very actually extensively in the vascular smooth muscles, arterioles, precapillary sphincters. And in order to this lecture is very easy على فكرة. Just remember what happens to you if you are allergic to something, or there is even the example that I have given you, the insect bite and the response that happens with it. Not only because we secrete histamine as a response to the allergy, it's because even the stinging secretions from the insect itself has got histamine. يعني هو already بيحقننا بhistamine already. So you will see all of these, and that will make actually your life easy to understand. So what will happen to blood vessels? Vasodilatation, yes. Because it actually vasodilates the vascular smooth muscles and the arterioles and precapillary sphincters. So increases the blood flow to the area of injury or inflammation. Again, target or another site of distribution of histamine 1 receptors in the endothelium. And what the endothelial cells are supposed to be tightly, adjacent or placed next to each other. But what will happen in allergy? They will be spaced apart. They will be actually separated from each other. So what does that is going to cause? Leakage. Yes, leakage of or transudation of the actually blood and water from the blood itself, with some of the inflammatory cells that are going to leave now the blood vessels and go to the interstitial fluid and cause edema. Bronchial smooth muscles, what will happen in severe allergy? It causes actually contractility of bronchial smooth muscles, and that is actually هم بيقول لك smooth muscles is likely to be dilated, except the bronchial smooth muscles is going to be constricted, so it will cause bronchoconstriction. Think about it as severe allergic response. They will be breathless, right? And this is part of the bronchial asthma. Okay, it's the same thing, because bronchial asthma, one of the mediators in bronchial asthma is histamine release, but not all of it. Okay, in the brain, I told you that histamine is very important for the distribution of histamine 1 receptors in the hypothalamus, makes you awake, and that's important for sleep awake cycle, cognitive function, and alertness. Okay, and not even that, in the peripheral neurons, we said it's very important for the sensitization and feeling the pain and the itchiness that you have with the insect bite. Okay, so that's another stimulation. These peptides stimulate the sensory neuron endings and then become actually very itchy and painful. So now the triple response is redness, as you mentioned. Redness is caused by what? By vasodilatation, right? By the vascular smooth muscle dilatation that happens in the blood vessels and vasodilatation. And after that, followed by edema, and that's caused by the endothelium. Once the endothelial cells separated, they will start to leakage. This leakage will happen. And the last one is the flare, or feeling the burning sensation and the itchiness, and that's promoted by the sensitization of the sensory nerve endings. واضح? Well, this is the typical response that happens with histamine or allergic response. H2, gastric mucosa, parietal cells, intestinal smooth muscles, and cardiac muscles. مختلف تماما صح؟ they say, although that they are histamine 1, histamine 2, to be honest, they're not similar to each other in their structure, okay? They've noticed that histamine 1 receptors are more similar to muscarinic receptors rather than being similar to H2. Okay, Banat? And H2, they have similarity with serotonin receptor. So accordingly, you will have these, although that they belong to the same family, histamine receptors, but H1 are completely different from H2, okay? And that makes you think that maybe H1 will have some muscarinic activity, صح? Because they look like muscarinic receptors, so they might have something related to the autonomic nervous system. And this is true when we talk about their antagonists, okay? So that's histamine 1. So what is histamine 2 now? The one that is different from histamine, what's histamine 2 which is different from histamine 1? It is available in the gastric mucosa parietal cells, and that's why we said it's important for gastric acid secretion and acidity, okay? Intestinal smooth muscles, it causes contractility of the intestinal smooth muscles, so that will increase the motility and cause diarrhea. And the cardiac muscles, it has a stimulant activity. It stimulates cardiac contractility and stimulate the cardiac pacemaker cells, so that increase the heart rate. Different pathways, all right? What will happen in anaphylactic reaction? That will summarize everything for you, because in anaphylactic reaction, you have neurotransmitter, too many mediators for inflammatory mediators are being released. Part of them is histamine. It will act on all receptors, all right? يعني مش بس histamine 1, even histamine 2, okay? So if you see an anaphylactic shock, what are the features of anaphylactic shock? أيوة, why?
Because of the
Vasodilatation أول حاجة, yes. So seeing this vasodilatation, that makes blood pressure drops. This is classic in anaphylactic reaction, always hypertensive, okay? طيب, what else? What happens in the heart rate in anaphylactic reaction? Increase tachycardia. Yes, they are actually tachycardic. Why tachycardic? تفضل. The part of it, yes, is the stimulation of H2, because they stimulate contractility and pacemaker cells. But we have actually a more important mechanism to cause this tachycardia. Huh? Yes, exactly. The vasodilatation that happens because it's huge and tremendous, not only because of histamine, even nitric oxides being released in anaphylactic reaction. So this, I would say, extensive vasodilatation will cause this significant drop in blood pressure. عندك الباروreceptors شغالة, okay? So that will stimulate the sympathetic nervous system and try to increase the heart rate. So this is important. What else we see in anaphylaxis? كلها هنا موجود. Huh? Yes, they are very breathless and they have bronchospasm. Yes, excellent. What else? Edema. Usually في anaphylaxis, it's a systemic reaction, but you might see sometimes swelling of the lips, right? It depends on, sometimes you can see eruption or hyperemia or redness of the skin. Yes, so that's part of it. Diarrhea. Yes, they will have actually loose bowel motion with that, okay? So basically you are having the involvement of more than one receptor anaphylactic reaction. Okay, what about H3 receptors? We said طبعا حطيتهم in a small font because they are actually still more and more research about them. They are presynaptic autoreceptors, as I told you once. H1, H2 go to the targets. Some of the release histamine is going to control its own release by histamine 3. You will find it as a presynaptic autoreceptor for modulating the release of several transmitters. Again, histamine 3 receptor and even 1, they are important to regulate appetite and satiety. It makes you feel that after eating a meal that what you have taken is adequate, so you don't need to eat anymore. So that's important for controlling your body weight in a good manner. So it controls the body weight and control the energy expenditure in a physiological manner. problems. So, experimental animals, when they have actually taken out or they cause actually uh, absence, or they call them knockout mice, when they do not have histamine 3 receptors, they gain weight and they eat too much. Okay, so this is again something target for obesity later on in future research. Histamine 3, 4 is this is the one that I told you that has been discovered to be important for chemotaxis. Okay, now do we need يا جماعة طبعا this slide is going to show you, yeah, just to help you to study bronchoconstriction, okay, dilatation blood vessels, tachycardia, vessels and capillary increased permeability and edema. Blood clotting is one of the actually targets. Again, platelet aggregation happens with histamine release. Stimulation gastric acid secretion, swelling and inflammation, and adrenaline release, because يعني part of subhanallah compensatory mechanism that happens with this histamine release is to have the physiological antagonist for it عشان to stop في عندي auto regulation, and we have actually adrenaline because it's the physiological antagonist for it, so we need to stop this response that happens. Again, this is the systemic effect of histamine. This is a slide show you what is the effect of histamine 1, 2, 3, and 4. This is I have taken it from a very recent paper, so you don't need to know everything about it because more and more is being known. But just know that histamine 1 is important for vasodilatation, bronchoconstriction, platelet aggregation, and hypermucus secretions. Part of the allergic response طبعا في the secretions increased. Histamine 2 is important for gastric acid secretion, increase heart rate and cardiac output. Histamine 3, sleep awake cycle, cognition, energy. Okay, histamine 4 is for chemotaxis and immune modulation. طيب, now do we use histamine? احنا we said we have histamine as a drug. تمام؟ إذا في questions الله يسعدك إذا ممكن بس أنا I don't know if they are asking any questions or they want me to.
Does histamine increase the contractility of the heart muscle?
Yes, yeah, it's already there. Increase contractility as well as the pace and heart rate. طيب, we said that we have histamine as a medicine. Is there any situation where you need to use histamine, knowing that all of this deleterious effect with inflammation and allergy? Do you expect that we have any indication to use histamine?
No.
ما في, right? Yeah. We did have an old indication that's not being used anymore. Even it was actually part of the autonomic nervous system. I used to give it methacholine challenge test, but then because it's not being used very often, so I deleted it from the slide. Okay, what does that mean? It means actually this is a way, an old, I would say, for old-fashioned investigation for bronchial asthma. If you're not sure about whether that individual is asthmatic or not because he's giving history of on and off dyspnea and cough, what you need to do is to bring them to the spirometry lab or pulmonary function test lab, okay, and make them inhale a substance that is going to cause bronchoconstriction by nebulization and see the response. They will be breathless, أكيد, صح? If they are asthmatic, and they will have cough and يعني bronchospasm, and you can measure the narrowing that has happened to them by spirometry. يعني you do a baseline pulmonary function test, get them exposed to a substance that's causing for them bronchospasm because they are very sensitive, صح? Not like normal individuals. And then assess this bronchospasm that happens with spirometry, and you can even reverse that by beta 2 agonist. يعني في طبعا عشان ما تخليه يروح البيت وهو صح يعني عنده bronchospasm. Okay, so we can do that by histamine. We can give them histamine in that nebulization, or methacholine. You remember methacholine? It was one of the cholinergic agonists that we have taken, and we said that acetylcholine is going to cause bronchoconstriction. So either this or that. But nowadays they have actually better spirometry measures, so we do not need actually to do it, but it's still there. Yani feed something. Still there is histamine challenge test or methacholine challenge test. What we need to do actually is to have histamine antagonism. This is what we need to do to treat patients with allergy. You know that epinephrine, you have taken that in your basic pharmacology, is a physiological antagonist, معروف, صح? And epinephrine is the life-saving medicine in anaphylaxis. And we said anaphylaxis, we know the features. What are you going to do as an emergency treatment for somebody with anaphylactic reaction? Yeah, epinephrine very, very quickly. And طبعا if they arrive to hospital, we'll give them طبعا epinephrine. Okay, لا But if they are known to be sort of very severely allergic, or they have this anaphylactic reaction whenever they get insect bite, على فكرة it does happen. If they get like bite by spider or ant or something, يعني a certain insect, they will have this severe reaction, and it might not be enough time. There might not be enough time for them to arrive to hospital. So what do we give them? What do you see here in front of you? EpiPen. That's epinephrine auto-injector. Okay? يعني in case they are going for a trip ولا farm ولا مش عارف مين, okay, they get trained, and there is على فكرة there is EpiPen trainer or simulation, يعني it's a kind of, they train them how to give themselves the pen. They only need to, this blue cap, they need just to open it and just put it against the skin. طبعا the easiest is the thigh, all right? And automatically it will give them, طبعا ما في وقت يعني نحن نشيل ونحط, صح ولا لا؟ يعني it's very 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 quick. Once they put it against, firmly placed against the thigh, it will give an intramuscular, هتكون deep, okay, injection of epinephrine, okay. Don't worry, even if it's subcutaneous, it will be absorbed, no problem. But I mean, it is actually designed in a way that will give an IM injection, fixed dose. So he will give himself this injection, and that will be life-saving, or him, or somebody from the family. But the patient needs to be trained on it because they might be alone when the response happens. Okay, so this is EpiPen, and it's actually expensive, لكن يعني it does help. So this is a physiological antagonist of histamine indicated for anaphylactic reaction. Any other allergic response, fee time, we do not need to give epinephrine. Okay, we have release inhibitors, mast cell, we call them mast cell stabilizer. You take them when you take bronchial asthma. بتاخذ respiratory block. بعدين you will study two medicines, cromolyn and nidocromil. Despite the fact that there is an antigen with immunoglobulin already pre-synthesized, bind together on the surface of mast cell, they will not cause the degranulation, okay? But their effect is mild في الواقع. Okay, so they're not sort of one of the first line. They have selected indication of bronchial asthma, like exercise-induced asthma, or يعني something that they take it before they go for the stimulus or the trigger, get exposed to the trigger. The most important are histamine receptor antagonists. صح? This is what we want. We want to antagonize H1 for allergy. And we want to antagonize H2 for, can you give me the indication? طبعا هي مش معانا في المحاضرة اليوم بس. Can you give me the indication? Why do we need to antagonize H2?
Maybe isolation.
أيوة. Yes, very important. These are the most important drugs for peptic ulcer disease. Excellent. طيب. Histamine 1 receptor antagonists, they are competitive antagonists to H1. Some references, they classify them as inverse agonists. Do you know what is inverse agonist? Yeah. Huh? Afan?
It will lead to opposite effect of the agonist.
Yes, you remember the curve. You know, the agonist is the dose response curve is like top. Antagonist is a flat line, صح? Because it occupies the receptor and will not allow the endogenous ligand to reach. Inverse agonist, it's the opposite, down. Because what it does, that it changes the constitutive activity of the receptor. Receptor itself becomes inactive rather than active. في histamine, ما في histamine, the receptor already is inactive. Excellent. So anyway, whether they are في الواقع competitive antagonist or inverse agonist, anyway, they will block the histamine effect. We have first generation and we have second generation. And when we say we have two generations, there must be a reason that makes us not preferring the first generation. Can anybody tell me why? Everybody knows, every family knows. What's the problem of anti-allergy medication? حد يعرف؟ sedation, صح؟ أي أحد بياخذ دواء حساسية بينام، صح؟ This is well known, okay? So the first generation H1 antagonists, look, they are actually very old group of medicines. Diphenhydramine is the prototype, the most important, or the first one, يعني synthesized and developed. Promethazine, chlorpheniramine, and cyproheptadine, okay? Please know them because they are still used, okay? And the second generation, to avoid the sedation that has been actually caused by the first generation, cetirizine, levocetirizine, loratadine, dysloratadine and fixofenadine. If you notice that actually some of them are active metabolites from the other. يعني cetirizine is a drug. It has an active metabolite, levocetirizine. So some drug companies, they said, let's market levocetirizine and levocetirizine. Do you see what I mean? So you have the parent and you have the active metabolite. Loratadine, dysloratadine. So you can find in the pharmacy loratadine, and you can find dysloratadine in some actually other pharmacies. So, and that's why if you read, in your textbook, they are classified into first and second generation. Some people, they think that the active metabolites like dysloratadine and levocetirizine, these should be known third generation. عملية فلسفة مش أكثر ولا أقل, okay? But anyway, all of them are the newer generations. So we just classify them into first and second, okay? Do you see they are actually quite recent and they are very, very good. Efficacy, same. Main difference is the second generation are less sedating than the first generation. Now let's see actually, according to the kinetics, why they are more sedating. They are rapidly absorbed orally. Within 1 hour, they will relieve the allergic response, which is great, and metabolized in the liver. The half-life, why we prefer second over the first? Half-life for the first, 4 to 6 hours. Half-life for the second, once daily administration is adequate, which is great. Why they are actually causing the sedation? Because they are highly lipid soluble and they can cross the blood-brain barrier and go and antagonize each one in the hypothalamus. And that's why they are causing the opposite of awakening or wakefulness. That's why they will cause sedation and drowsiness. واضح الميكانيزم؟ طيب. H1 عفوا the second generation, they are less lipid soluble, do not cross blood-brain barrier. Even if they do, they're very, very little of them, okay? And accordingly, they will not actually cause sedation and drowsiness. واضح الدifference? Yes.
Regarding the adverse effect sedation, it's H1 antagonist, but the receptor that responsible for the awakening is H3. How will it?
لا, H1 for the wakefulness. It's H1 that I explained to you. في more than one explanation. They say even it interacts with acetylcholine and glutamate and more than one mechanism. But what I was able to find in papers, why actually it's important for cognition and wakefulness is H1 in the hypothalamus, okay? But that's why if you antagonize it, you're going to cause sedation and drowsiness. But these ones will not cause. Again, look at the side. This is actually makes you feel that there are actually some side effects. First generation, they block muscarinic receptor. You remember, احنا أعطيناكم cholinergic antagonist. If a drug that causes anticholinergic reaction, what is it going to cause? Can anybody tell me? قبل ما نروح للسلايد الادفيرس effect. أيوة. لا مو ديسيستم. اتروبين لايك افكت. فاكرين هي ايش؟ blurred vision صح؟ you cannot focus for the near vision. كان في urinary bladder urinary retention في GIT constipation okay secretions dry mouth صح؟ بليز الانتيكولينرجيك ريسبونس هذا تحفظونه زي اساميكم الله يعافيكم. Okay, why? Because the more you study pharmacology, you will find a lot of drugs, unfortunately, they block cholinergic receptors. you are giving like this is an example. This is a very, very important example. I am giving them to block histamine 1 to block the allergic response. تروح block muscarinic receptor. Okay? So you should know here that they are going to cause dry mouth, blurred vision, urinary retention, constipation. صح? For that reason, if you have somebody who is old, man, he might have a prostate issue. صح? Okay? And he needs now an anti-allergic medication. Which generation you're going to give him? Definitely. Okay? Why? Because you know that the first generation are going to will worsen for him urinary retention. So they block muscarinic receptor. They even block alpha-adrenergic receptor, alpha 1. The thing that blocks alpha 1 adrenergic receptor, what's it going to cause? And blood pressure? Decrease, especially postural hypotension. Okay, اللي عارفين هذا الشيء excellent. They block serotonin receptor. That's again يعني another ممكن probably affect the adverse effect profile. They block sodium channels in excitable membranes and neurons. If you remember your action potential, طبعا هذه حتاخذوها في في النيورو بلوك بعدين, the blockade of sodium channels. Okay, if you know your action potential for the neurons, depolarization depends on opening sodium channels, right? If you block the sodium channels, depolarization becomes actually not upstroke, حتكون شوية يعني shallow because it takes time, and the action potential duration becomes very long. Okay, is this an issue for us? This is an explanation for why they might cause cardiac arrhythmia. مهم. Okay, so now I told you that the spectrum of activity or the pharmacokinetics, you know the difference, pharmacodynamics, all of these, you know, a lot of effects with the first generation and it is avoided in second generation. يعني very little أقصد هنا في الانتيكولينرجيك, الأذرز ما في, يعني الألفا, السيروتونين, sodium, again sodium channels, they can even block the sodium channels. But anyway, here is actually less than in the first generation. When we use them, any allergic response طبعا, allergic rhinitis, hay fever, urticaria, atopic dermatitis, everything is there. They're not part of bronchial asthma treatment. Why? Because bronchial asthma have many mediators, not only histamine. If you give antihistamine, it's not going to cause actually a tremendous difference. Motion sickness. Okay, you remember motion sickness, vestibular disturbance اللي حكينا عنه في الcholinergic agonist to antagonist. What was the drug of choice? We need scopolamine. Yes, we need a long-acting, highly lipid-soluble, صح? Cholinergic antagonist. Okay, because we said that in the key, I explained to you, chemoreceptor triggerzone, we have receptors and part of them كانت muscarinic receptors, acetylcholine receptors. But I did also told you that histamine receptors is there, serotonin receptors is there, dopamine receptors are there. Okay, in the chemoreceptor trigger zone and vomiting center. So do you see here the first generation? We need the first generation because they are highly lipid soluble. They can reach the brain, and scopolamine are the best examples. Nausea and vomiting of pregnancy. There was a drug called doxylamine, one of the antihistamines that has been used for pregnant women for morning sickness, nausea, vomiting that happens with early pregnancy. But then it was withdrawn from the market for some cases, reports about the fetal malformation. But then more and more studies were done and it was found to be actually beneficial without risk for the fetus malformation, and that was introduced back again. طيب, adverse effect now, I guess you know that the most important are the sedation, okay? Because it's very dangerous if somebody is driving heavy vehicle or having some sharp machinery or working on a factory or something like that. You do not want them to be drowsy or, not sort of feeling sedated or drowsy, because that will cause accidents, okay? So that's actually important. Try to avoid that by giving the second generation. Is there any situation where we need sedation? If somebody has got insomnia, okay, this off-label use, but they are actually, don't think in the first generation nobody prefers them. If you have a severe allergic response that the patient can, from itchiness, urticaria, cannot sleep, do you prefer first or second? طبعا, okay. If somebody has got sleeping problems, you will take, inshallah, in the next block, that sleeping pills are always addictive. كلكم تعرفون هذا الكلام, صح? These ones are not causing addiction. These are going to help the patient to sleep without the addiction, without the tolerance. So whenever they stop them, خلاص, they can actually sleep naturally. Okay, so there are some people or some individuals that where we need sedation for. Anticholinergic activity, I explained it to you. In comparison to having sedation in old and مش old, أقصد most of the individuals, the children, they might have a paradoxical response, العكسي, يكون عندهم excitation. That's why we try to avoid the first generation, and there are selected antihistamines actually licensed or approved for children. Postural hypotension, it comes from the anticholinergic effect. Cardiac arrhythmia, as I told you once, they block the sodium channels. They're going to prolong action potential, and prolongation of QT interval. If you have taken that, then that predisposes to a certain arrhythmia that happens. البروستاجلاندينز في الواقع يا شباب يعني you can time is over, you can read that. Prostaglandins is only 2 slides because these are part of the autocoids, belong to a family called eicosanoids, and you will study them in individual lectures. يعني for example, we have some prostaglandins here, like iloprost is used for pulmonary hypertension. You will take it in the pulmonary block, okay? في مثلا في الrenal block you have a certain treatment for benign prostatic hyperplasia محاضرة حتاخذوها with erectile dysfunction. We use alprostadil, okay? Another preparation prostaglandin. See what is the effect that they're going to cause. Again, they are mediators of inflammation, so they must be causing vasodilatation, okay? And smooth muscle, again, they can control the tone of the smooth muscle. So look at what they are doing and then use structural analogues for them to treat a certain disease. So you will have them in GI block, you will hear about them, renal block, you hear about them, and even respiratory block. يعني that's why I put only 2 slides of them. But antihistamines are the main subject of this lecture because ما حتنعاد لكم بعد كده. Do you have any question about antihistamines? واضحة الالرجي medication? Yes.
Can you please mention that H1 is similar to muscarinic receptor?
ايوه.
And what H2 is similar to?
Serotonin. يعني when you see actually here this one يعني a receptor or an antagonist that actually has gone beyond the receptor itself and caused مثلا blocked another receptor. It's because of similarity in the structure of the receptor. عرفت كيف؟ That's why for H1, the first generation, okay, they're likely to go and block more than one receptor, more than the second generation, more specifically H1. عرفت كيف؟ That's why you will have actually a bigger sort of adverse effect profile with the first generation. But I think sedation, when you go clinically, you will find actually that some of the patients really you can help them by giving them antihistamine receptors in order to help them to sleep, because it's not going to cause dependence or tolerance like the benzodiazepines, which is the classic sedative drugs that is helping in sleep. بس يعني حتاخذوها إن شاء الله في النيوروساينس.
Will we take more questions?
Sorry?
Will we take questions from the online students?
أيوة ما I don't know. Do we have some? Stop the share.
No, it's just sure.
Mhm.
Stop.
Do you have them?
Okay, so this one, let's go for a minute.
What's that? Yeah. We give second generation, so he does not retain urine. Yes, actually, the second generation are less likely to cause the anticholinergic effect, so the patient is able to pass urine. طبعا this effect on anticholinergic activity is more like to be noticed with old patients if they have some resistance to urine flow. So yes, if you give them the first generation, it's going to make it worse. Second generation are better. Can you doctor repeat the pharmacodynamics of first generation of? Yeah, we said that they are going to, in addition to the blockade of H1 receptor, they're going to block other receptors that have got some similarities in the structure of the receptor. So H1 are less specific to H1 antagonists are less specific to histamine receptors, so they might block muscarinic receptor because there is some similarity with the receptor itself. So as you can see here, there are 3 pluses. That means they have an anticholinergic activity. Again, they block alpha-1 adrenergic receptors, okay? And once they block alpha-1 adrenergic receptors, it's going to cause postural hypotension, and that's important. They block serotonin, they block sodium channels, so they do have actually more than one receptor that they can block. And accordingly, the side effect profile is going to be more than the side effect profile in the second generation. Is the chemical release histamine is type 3 allergy? I don't know, honestly, what is that, but they say the medication or the chemicals that are causing histamine release, they cause that by displacement only. So I don't think it's classified as type 3 hypersensitivity reaction, but I can find out for you. It's only selected drugs that are causing the displacement. That's it? Okay, المطلوبين يا بنات ان شاء الله كويس.